We want to see a system that can provide the care that Canadians deserve. And that's going to mean some changes, and I want to be part of that future, part of that solution.
I think you've really found your calling. You moved a whole province. We came through that wave really ahead of the game, largely because of the vaccine campaign that you orchestrated.
We had that whole medical table, all the different specialties working together to try to come up with the best possible plan. So people like you were instrumental in guiding me to make the final decisions about what I was going to take to the decision makers, the politicians, to try to push forward. So I may have been the face, but that team was really who guided all of those decisions.
Who knew anything about COVID-19? And you were so upfront in the media with what science could tell us, what the unknowns were, and had that really human element, like constantly thinking of, who's not at the table. At a time where there was a lot of potential for distrust or mistrust, you really made sure that in Manitoba, we maintained trust in our public health and in our physicians and in our health service.
I think a lot of that comes out of the training I got at the University of Manitoba, because in public health specifically, we learn a lot about communication, and we do media training, but you learn about how uncertainty isn't always a negative thing, that when you're too certain, you can lose trust because people don't believe that you know everything about everything. And so we got taught the importance of being honest with the public, but also trying to take these really complex topics and make them simple.
You've brought attention to mental health issues among physicians in Canada, also the hours of work that we work. How has that impacted your current position as CMA president?
Well, when we first met was actually during one of the toughest times in my life, because when I was in residency is when I went through burnout. And burnout can be a very traumatic experience, and it's a complicated subject because it's not just about the hours you work, although that's a big part of it. It's also about feeling valued in your career, feeling like you're making an impact, that your work is meaningful. But what it really taught me was that with the right supports, with the right environment, most people can thrive. Even if you have a mental illness, even if you've experienced burnout, we can often shape the workplace and shape environments to support people where they can do amazing things.
I think it was in 2022 that you got the Humanitarian of the Year award from Doctors Manitoba. Can you tell me a little bit about what it was like?
It was such an incredible honor to be named Humanitarian of the Year, particularly because it came from my colleagues. I had done all the media and the public had seen the work that was put out publicly, but this came from people who actually knew me. And so to have those people feel that I deserved to be given an award was just extra special, especially because I saw how hard all of them worked.
I think you're so deserving of this award because not only of what you've accomplished, all the vaccines in arms, but the way in which you carried yourself and represented your training and our profession. And I think the vision for where we want medicine to go is to be humans treating humans. And I think you embody that.